Hey, my name is Ava Bishop, and I am doing an infectious disease project for microbiology lab. Excuse my voice, I've been sick. I chose anthrax, and I'm going to tell you everything about anthrax that I researched. Anthrax is a disease caused by Bacillus anthracis, a germ that lives in the soil. Many people know about it from the 2001 Bioterror attacks. In the attacks, someone purposely spread anthrax through the U.S. mail, and it killed 5 people and injured 22. Bacillus anthracis is a gram-positive and rod-shaped bacterium. To culture the bacterium, you inoculate it. You take a blood sample and you inoculate it on a blood agar, and you incubate the plate at 37 degrees Celsius for 18 to 24 hours. Then you read the plate for the colony characters. And make sure you do that immediately after drawing the blood. You don't want to hold on to it for too long. And you can isolate it. For isolation, anthrax, and confirmation of healthy blend, you would do 2 volumes of sterile distilled water, and you would use a buffer if it's likely to have a very low or high pH. And then you don't want to do this on anybody that's been treated with any antibiotics. The cycle of infection of anthrax is the spore is central in the cycle. Although vegetative forms may also play a role in establishing infection when, for example, humans or carnivores eat meat from an animal that died of anthrax, or when biting flies transmit the disease. The infectivity of the vegetative form is difficult to establish since it is close to impossible to prepare truly spore-free vegetative cell suspensions in the laboratory. How the organism causes diseases. Anthrax is rare. It affects animals such as cattle, sheep, and goats more often than people. People can get anthrax from contact with infected animals, wool, meat, and hides. It can cause 3 forms of disease in people. They are cutaneous, which affects the skin. People with cuts or open sores can get it if they touch the bacteria. You can inhale it, which affects the lungs. You can get this if you breathe in spores from the bacteria. And then gastrointestinal, which affects the digestive system. You can get this by eating infected meat. Bacillus anthracis is a very rare bacterium, and it causes disease infrequently. It is present naturally in both wild and domestic animals and in soil, particularly where an infected animal has died or been killed. People in contact with infected animals are higher risk of getting anthrax. The signs and symptoms of the 3 types of anthrax. The first one is cutaneous anthrax. Is a characteristic rash. The rash looks like pink, itchy bumps that occur at the site where Bacillus anthracis comes into contact with scratched or otherwise open skin. The pink bumps progress to blisters, which further progress to open sores with a black base. The early rash looks like many other rashes. So a history of exposure to bacterium will be important to making the diagnosis. The second one is inhalation anthrax. The early symptoms are cold or flu-like illness, fever, aches, and sore throat. The latter symptoms is cough, chest pain, and shortness of breath. And then the last one is gastrointestinal anthrax. The symptoms of that are fever, nausea, decreased appetite, diarrhea, usually bloody, and abdominal pain. And how you diagnose anthrax. Your doctor will ask you what kind of work you do, along with other questions to determine the likelihood of you being exposed to anthrax. He or she will first want to rule out other more common conditions that may be causing your signs and symptoms, such as flu or pneumonia. You may have a rapid flu test to quickly get diagnosed for the flu. If other tests are negative, you may have further tests to look especially for anthrax, such as skin testing. A sample or fluid from the suspicious lesion from your skin, or a small tissue sample, a biopsy, may be tested in the lab for signs of cutaneous anthrax. They may draw your blood and do some blood tests to check for the bacteria of anthrax. They may do chest x-rays and CT scans. A stool testing to test for gastrointestinal anthrax. Or a spinal tap or lumbar puncture. And this is to test when people have somatic anthrax other than your cutaneous anthrax, and it's due to the possibility of meningitis. The treatment of anthrax is antibiotics such as ciprofloxacin, doxycycline, vancomycin, levothyroxine. When single antibiotic or combination, sometimes they may use a single antibiotic, sometimes they may use a combination of antibiotics. And the length of treatment will depend on your age and your overall health and other factors. And you need to start treatment as soon as possible. Some cases of injection anthrax have been successfully treated with surgical removal of the infected tissue. Although some cases of anthrax respond to antibiotics, advanced inhalation anthrax by the later stages the bacteria have often produced more toxins than the drugs can eliminate. And then the prevention of anthrax. Anthrax is rare, like I said, and most people will never be exposed to it. There is a vaccine licensed to prevent anthrax, but it's only recommended for routine in certain groups of people that are at high risk. For example, some members of the military and laboratory workers. For people who have not been exposed to anthrax, but do have people that have been exposed to anthrax but do not have symptoms yet, certain antibiotics can prevent illness from developing. Thank you so much for your time.